What if I told you that in one of the most frightening moments a person can experience, the power to protect your future, your memories, and your independence rests squarely in your own hands? Imagine for a moment that you are at home, perhaps reading a book or watching the birds outside your window. Suddenly, a strange sensation washes over you, a dizziness that's more than just lightheadedness, a numbness that tingles in your arm, or a sudden confusion that makes the familiar feel foreign. This is the moment when panic can take hold, when a feeling of helplessness can be overwhelming. In these critical seconds and minutes, as the shadow of a potential stroke falls, most people believe they are powerless until help arrives. They believe their fate is entirely in the hands of the paramedics and doctors. But that belief, as well-intentioned as it is not entirely true. There is a profound gap in time between the first symptom and the arrival of medical help. And what you do in that gap can change everything. It can be the difference between a full recovery and a life altered forever. It's not about complex medical procedures or knowledge you couldn't possibly have. It's about a few simple, deliberate actions, a sequence so powerful it can shield your brain from the worst of the damage. This is the knowledge that turns a victim into an active participant in their own rescue. It's about taking control when you feel most out of control. My name is Dr. Lucas Mason, and in my more than 30 years of caring for patients who have faced neurological emergencies, I have seen firsthand how the small, correct choices made in the first few minutes can lead to astonishingly different outcomes. I've seen how preparedness replaces panic and how a clear mind can protect the brain. So what is this 3-minute trick that can stop a stroke in its tracks? How can you protect yourself and your loved ones? Before continuing, if you haven't subscribed yet, click the bell icon so you don't miss out on any health tips designed especially for you. If you like the video, give it a thumbs up and leave a comment. If not, give it a thumbs down to help us improve. The very first sign of trouble, that initial wave of dizziness, weakness, or confusion, triggers a primal instinct to stand up, to move, to try and shake it off. But this instinct is precisely the wrong one. The most immediate and catastrophic danger in the first moment of a stroke is not the stroke itself, but the fall that it can cause. A fall when your body is this vulnerable can lead to a secondary injury, like a traumatic brain injury from hitting your head, or a fractured hip. These complications can be more devastating than the initial stroke, creating a cascade of medical problems that make recovery infinitely more difficult. So the first, most crucial action is the simplest one imaginable. Sit down immediately. It doesn't matter where you are in the kitchen, the garden, or walking down the hallway. Find the nearest chair, sofa, or even the floor and lower yourself gently. Think of this action as deploying your personal gravity shield. You are neutralizing the single greatest threat in that moment. I remember a patient of mine, a wonderful gentleman named Robert. He was in his workshop, a place where he'd spent thousands of happy hours. He felt his left side go weak and a strange metallic taste fill his mouth. His first thought was to get to the phone in the kitchen, but he remembered a conversation we had about this very topic. Instead of taking a single step, he lowered himself onto a nearby stool. By the time his wife found him a minute later, he couldn't stand, but he was safe. He hadn't fallen. He hadn't hit his head on the hard concrete floor. That one decision, to sit, meant we were only treating the stroke, not a stroke and a severe concussion. It made all the difference in his recovery. Sitting down does more than just prevent a fall. It's a signal to your body to conserve energy. It stops you from demanding more from a system that is already in crisis. It's the foundational step that makes all the other life-saving actions possible. So please burn this into your mind. First symptom, first action, sit. Don T, negotiate with the feeling. Don T, try to be brave and walk it off. Just sit. It is the most powerful first move you can make on the chessboard of your own survival. Once you are safely seated and the danger of a fall has been eliminated, the next step is to optimize the environment inside your body. The brain during a stroke is being starved of one of two things: either blood flow, in the case of an ischemic stroke, or it's dealing with a bleed in a hemorrhagic stroke. In both cases, but especially in the far more common ischemic stroke, improving blood flow to the brain is paramount. When you are sitting or standing, gravity is your enemy. It pulls blood down, away from your head, forcing your already strained heart to work harder to pump it upward to where it's needed most. This is why the second critical action is to lie down, specifically on your back. If you've made it to a sofa or bed, this is straightforward. If you've sat down on the floor, gently lower yourself so you are lying flat. Think of your circulatory system as a river. During a stroke, a dam has appeared somewhere in that river, blocking the flow to a critical area. By lying down, you are leveling the riverbed, making it as easy as possible for the water to get where it needs to go. You are removing the obstacle of gravity. This simple change in posture can significantly increase what we call cerebral perfusion, the amount of blood reaching the brain tissue. It might only be a small percentage increase, but when brain cells are dying with every passing second, every single drop of oxygenated blood counts. Lying on your back also helps to stabilize your entire system. It prevents the wild swings in blood pressure that can happen when you try to sit up or stand while your brain's control center is compromised. It provides a stable, secure position from which you can execute the next steps. It might feel counterintuitive. You might feel a need to be upright, to be in control. But true control in this moment comes from working with your body, not against it. Lying flat is an act of profound surrender to what your brain needs most: a clear, unobstructed path for its lifeline of blood. It's about creating the perfect internal conditions for preservation while you wait for external help to arrive. Now that you are lying flat on your back, with gravity no longer working against you, we can take it one step further. We can actively encourage blood to move from the extremities where it's less critical to the core of your body and, most importantly, up to your brain. This is where the third action comes in. Elevate your legs. You didn't need anything fancy. A couple of pillows, a rolled-up blanket, or the cushions from the sofa will do. The goal is to raise your feet approximately 12 inches, or about 30 centimeters, above the level of your heart. What does this simple action achieve? It's a beautiful and effective trick of physics. By raising your legs, you are using gravity, which was once your enemy, and making it your ally. You are encouraging the large volume of blood that rests in your legs to drain back toward your torso. This increases the amount of blood available in your central circulation, which means your heart has more to work with. It doesn't have to pump as hard to get the same amount of blood to your vital organs, including your brain. Imagine tilting a water bottle to get the last few drops out. You are essentially doing the same for your body, ensuring that every precious resource is directed toward the crisis center. This action works in beautiful harmony with the previous step of lying down. Lying down levels the playing field, and elevating the legs provides a gentle, persistent nudge. telling your blood exactly where it needs to go. This can help to raise blood pressure just enough to push past the blockage or supply adjacent areas of the brain, a process known as collateral circulation. It's like finding a small detour around a major traffic jam. It might not be perfect, but it keeps things moving. This is not just a theory, it's a principle used in medicine to treat shock and improve circulation. You're applying a well-established medical technique to yourself in your own home. You are becoming your own first responder. Every action builds on the last. First, you ensure your safety by sitting. Second, you optimize blood flow by lying down. And third, you enhance that flow by elevating your legs. You have created a powerful three-step cocoon of self-preservation. You are calm, you are safe from falls, and you have created the best possible internal environment for your brain to weather this storm. With your body now positioned for optimal safety and blood flow, we must turn our attention to the most powerful and often overlooked organ in a crisis: your mind. When the body experiences something as terrifying as a stroke, the brain's alarm system, the sympathetic nervous system, goes into overdrive. Your heart starts pounding, your breathing becomes shallow and rapid, and a wave of panic sets in. This is the fight or flight response. While useful for escaping a predator, it is incredibly dangerous during a stroke. Why? Because panic causes something called vasoconstriction. Your blood vessels tighten and narrow. This is the absolute last thing you want when your brain is already being deprived of blood. Panic literally tightens the dam, making the blockage worse. This is where the fourth and perhaps most mentally empowering action comes in: controlled breathing. Specifically, a technique known as the 4-2-6 method. It is profoundly simple and profoundly effective. You breathe in slowly through your nose for a count of 4. You hold that breath gently for a count of 2. And then you exhale slowly and completely through your mouth for a count of 6. Let us think about that for a moment. In for 4, hold for 2, out for 6. The magic here is in the long exhale. A long, slow exhale is a direct signal to your vagus nerve, which is the superhighway of your parasympathetic nervous system. This is a rest and digest system. It does the exact opposite of the panic response. It slows your heart rate, it lowers your blood pressure, and most importantly, it promotes vasodilation. It helps your blood vessels to relax and widen. By consciously controlling your breath, you are hacking into your own nervous system. You are manually turning off the panic alarm and turning on the calm response. This is not just about feeling better mentally. It has a direct, physical, and protective effect on your brain. I encourage my patients to practice this breathing even when they are perfectly healthy, so it becomes second nature. Let us try it just once, right now. Breathe in, 1, 2, 3, 4. Hold 1, 2, and breathe out, 1, 2, 3, 4, 5, 6. Can you feel that? That sense of calm that washes over you. Imagine deploying that tool in a moment of crisis. It becomes your anchor in the storm. It keeps your mind clear, allowing you to remember these steps. It keeps your blood vessels as open as possible, giving your brain the best chance it has. This breath is your shield against the chaos of panic. You are not just a passenger in this experience. You are the pilot, calmly navigating your body towards safety. As you maintain your calm, controlled breathing, with your body in the optimal position for recovery, there is one small but monumentally important piece of information you must capture. This fifth action requires no physical effort, only a moment of observation. Look at a clock. a watch, a phone, the cable box, anything that can give you the time. And note the exact time your symptoms began. If you can remember the precise minute, get as close as you possibly can. Why is this so critical? It may seem like a trivial detail in the middle of a medical emergency, but to the medical team that will soon be treating you, that piece of information is like a golden key. It is arguably the most important piece of data you can provide. Here's why. The most effective treatments for ischemic strokes, the clot-busting drugs like TPA, tissue plasminogen activator, are incredibly time-sensitive. They can only be administered within a very specific window from the onset of symptoms, typically 3 to 4.5 hours. If a patient arrives at the hospital and we don't know when the stroke started, we lose precious time trying to figure it out. We might have to run extra scans, or worse, we might be unable to give the medication at all because we can't be certain it's safe. But if you can tell the paramedics, my symptoms started at 10:15 a.m., you have just unlocked the door to the most powerful treatments available. You have given your doctors the confidence to act swiftly and decisively. You have shaved off minutes, maybe even hours, of diagnostic delay. And in the world of stroke treatment, we have a saying, time is brain. Every minute saved is millions of brain cells saved. A patient I treated, a retired school teacher named Eleanor, had the presence of mind to do this. She felt her face begin to droop and immediately glanced at her kitchen clock. It was 2:40 p.m. When the ambulance arrived, that was the first thing she told them. That information was relayed to the hospital before she even arrived. The stroke team was assembled and waiting. We were able to confirm the diagnosis and administer the clot-busting drug well within the golden hour. Her recovery was, in a word, remarkable. Her foresight, her ability to capture that one simple detail, fundamentally altered her future. So as you lie there, breathing calmly, make a mental note. Say it out loud if you can. It's 10:15. This simple act of observation transforms you from being just a patient into a vital member of your own medical team. You are gathering the critical intelligence that will guide your own rescue. You have now executed 5 crucial steps. You are safe from falls. Your body is positioned to maximize blood flow to the brain. Your breathing is keeping your system calm and your blood vessels open. And you have noted the critical time of onset. Now, as you wait for help, which must be on its way, there are 2 final, intertwined actions. The 6th action is to remain completely still. The temptation might be to move, to stretch the numb limb, to try and sit up to see if you feel better. You must resist this temptation. Every movement, no matter how small, requires energy. It requires your heart to pump blood to the muscles involved. It places a demand on a system that is already in a state of extreme crisis. All of your body's resources, every bit of oxygen, and every drop of blood need to be focused on one single task: preserving your brain. Being still is an act of profound conservation. It minimizes the strain on your heart and circulatory system, allowing them to dedicate everything they have to the area in distress. This stillness also prevents further injury. A body compromised by a stroke has impaired coordination and balance. Even a small attempt to shift position could lead to a fall, even from a lying position, or could cause an injury you might not even feel at the time. So you remain still, a calm, quiet pillar of self-preservation. And this leads to the 7th and final action, which in truth should be initiated as soon as possible, perhaps by a loved one or even by you if you're able. This is the most decisive action of all. Call for emergency services immediately. There is no room for hesitation. There is no wait and see. The feelings of, I don't want to be a bother, or maybe it's just indigestion, can be fatal. A stroke is a medical emergency of the highest order. The steps we have discussed are brilliant, life-preserving bridges to get you from the moment of crisis to the moment of professional care. They are not a substitute for that care. You need the expertise of paramedics, the diagnostic tools of a hospital, and the specialized knowledge of a stroke team. So, call 911 or your local emergency number without a moment's delay. If someone is with you, have them make the call while you begin the first steps. If you are alone, make the call your first priority after ensuring you are in a safe position. Tell the dispatcher clearly, I think I am having a stroke. This phrase triggers a specific, high-priority response. These two final actions, remaining still and calling for help, are the bookends of your self-rescue. They ensure you are in the safest possible state, while also guaranteeing that the definitive medical care you need is on its way as fast as possible. Let's take a moment to bring all of this together. This isn't just a list of things to do. It is a seamless, logical sequence of self-protection, a life-saving choreography you can perform in just a few minutes. It begins the moment you feel something is wrong. First, you conquer the most immediate danger. You sit down immediately to prevent a fall. Second, you become an ally to your body. You lie flat on your back to make it easier for blood to reach your brain. Third, you enhance this effect. You elevate your legs about 12 inches to guide blood back to your core and up to your head. Fourth, you take control of your mind and your physiology. You breathe using the 4-2-6 pattern to calm your nervous system and keep your blood vessels open. Fifth, you become a crucial part of your medical team. You note the exact time the symptoms started, providing the golden key for treatment. And finally, you create a safe holding pattern while activating your rescue. You remain completely still and ensure that emergency services have been called immediately. This knowledge is not meant to create fear. It is meant to extinguish it. Fear thrives in the unknown, in the feeling of helplessness. But you are no longer helpless. You now possess a clear plan. You have a set of powerful tools that can protect your brain, preserve your function, and safeguard your independence. This preparedness transforms you from someone who a stroke happens to into someone who actively responds to a stroke with awareness and calm purpose. This is the ultimate form of empowerment. Your health is your greatest treasure. It is the vessel through which you experience all the joys of this life. Knowing how to protect it in a moment of crisis is one of the greatest gifts you can give yourself and your loved ones. Share this knowledge. Talk about it. Make it a part of your family's safety plan, because by turning fear into knowledge and panic into a plan, you are truly taking control of your well-being. Until next time, stay well.